Good morning, James. Thanks for taking my call about Mr. Harrison. Mihira began, reviewing her notes. He's been experiencing significant right-sided abdominal pain for the past week. Initially, I suspected gastritis, given his history of occasional indigestion, and started him on antacids. However, the pain has intensified and is now localized more in the lower quadrant. He mentioned some nausea, but no vomiting.
Right-sided lower quadrant pain, you say. Has he had any changes in bowel habits? Any fever or urinary symptoms?
No significant changes in bowel habits reported, and no dysuria or increased frequency. He did mention feeling slightly warmer last night, but his temperature was normal in the clinic this morning. The tricky part is that he also has a history of mild diverticulosis, diagnosed a couple of years ago, which has been asymptomatic until now. So, while appendicitis is certainly on my radar given the location and increasing severity of the pain, I can't completely rule out a flare-up of his diverticular disease.
I understand. Given the persistent and worsening localized pain, despite the lack of definitive fever or bowel changes, Mihira, I think it would be prudent to get him in for an urgent surgical assessment to properly evaluate for acute appendicitis. The diverticulosis history adds a layer of complexity, but the clinical picture you're describing leans more towards an acute inflammatory process in the appendix. We can always investigate the diverticulosis further if the appendix turns out to be unremarkable.
That aligns with my thoughts, James. I'll arrange for him to come to your clinic this afternoon then. Thank you for your prompt advice.
I understand how bothersome that constant mucus and congestion can be, Mihira, and I have some detailed suggestions that might help you manage it. The main goal is to thin the secretions so your body can clear them more easily. First, staying very well hydrated by drinking plenty of water throughout the day is key, as it helps to loosen the catarrh. It can also be helpful to sip a little cold water just before you need to clear your throat, as this can make the process gentler. You might also find relief from a saline nasal rinse or spray, which uses a gentle saltwater solution to moisten your nasal passages and wash away the thicker mucus. It's also a good idea to avoid a very warm and dry atmosphere if you can. Using a cool mist humidifier at home can add moisture to the air and soothe your airways. Alongside these methods, there are some over-the-counter medications that can provide relief, but it's important to choose the right one. Mihira, decongestants can help reduce swelling in your nasal passages and ease that blocked-up feeling, but they are usually only for short-term use. Antihistamines can be very effective if your catarrh is related to allergies, as they dry up secretions. Since everyone's situation is a little different, I'd recommend having a quick chat with a pharmacist when you pick something up. They can help you select the most suitable option based on your specific symptoms and any other health considerations.